Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight we have a doctor from Cohen Children's Medical Center to help you sort through what's going on with COVID-19 in the communities and across the region. And we want to hear from you. It's a call-in show, so call us at that number at the bottom, 516-393-1800. Well, children, for the most part, were thought to be spared from COVID-19. Well, until today, Governor Cuomo warned about a mysterious illness believed to be connected to the coronavirus that is affecting children. The rare syndrome causes life-threatening inflammation. Now, the governor said this is every parent's nightmare and would open up an entirely different chapter. County health officials say at least 74 cases of this new illness have been reported. That's statewide. Now, they say several are at Nassau hospitals. And Governor Cuomo says we are finally ahead of the virus, but we haven't killed the beast yet. That's his words. New York now is looking at more than 330,000 positive cases. Nassau Executive Cohen says there was a spike in new cases, and Suffolk, now adding in the positive antibody testing results to their numbers, also saw a jump. That's according to Suffolk Executive Steve Bellone. Long Island has upwards of 78,000 cases. New York is making progress. There's still pain, though, going on. The death toll in the state is still upwards of 21,000. More than 3,400 of those deaths right here in both of our counties on the island. All right, let's get to our discussion right now. And an expert on this new mysterious illness joining us tonight, Dr. James Schneider. He's the Chief of Pediatric Critical Care Medicine at Cohen Children's Medical Center. Thank you so much for everything you do. I know you must be exhausted. How are you holding up?
I'm okay. Thanks very much for asking. It's been a busy few weeks, but you know we're doing just fine. Thanks for asking.
Well, let me start off by asking about what the governor told us about today. It's called Pediatric Multi-System Inflammatory Syndrome. You're seeing that this affects children. Tell us about this.
Sure. So what we are seeing, and we've really recognized this new syndrome, this new presentation of coronavirus infection in children. It's only been around basically for about 2 weeks or so, and it was first kind of reported to us from our colleagues overseas in Europe and the UK. I think it's about the 27th of April, and around the same time, we started seeing in our hospital and other hospitals in the New York area, we were seeing kids present with signs and symptoms consistent or similar to a known disease in children called Kawasaki's disease. And they were presenting with fevers and abdominal symptoms like vomiting, diarrhea, so maybe red rash, some red injected eyes, maybe some swelling of the hands and feet. But more importantly, that a lot of these children were showing more signs of that their cardiovascular system was involved, and they were all much sicker, and the majority have needed ICU care.
And I know
so it's definitely it's new. It's new for us in the whole era of the COVID infections.
Yeah, I know we've already reported 2 deaths of children right now. Now, remdesivir doesn't work on this, right?
No, it's a really important question. So what we're noticing is that most of these children don't actually have an active or acute coronavirus infection, meaning if we were to do a nasal swab and look for a coronavirus, it'll come back negative. But we are seeing that many of them have evidence of having had a coronavirus infection in the past with the serum testing with the antibodies. Many are positive, which indicates that this is a post-infectious phenomenon, meaning the body has fought off, or the immune system has fought off the coronavirus, and the child may never have even known they had the symptoms or in the infection. And now the immune system is kind of overactive, and in the process is leading to inflammation of blood vessels of the body, which can affect many organs, but including the heart. And so therefore, there's no virus there. Remdesivir, which is directed at ideally killing the virus, it would not be effective, and it's not part of the treatment.
All right, so kids, beware out there. Let's go to get some questions in right now. Richard from Setauket. Richard, you there?
Yes, hi.
How are you? What's your question tonight?
Hi, Richard.
Hi, Dr. Schneider. My question
How are you?
is, I'm well. I'm hoping you're doing well, and thanks for all you do. My question is that my wife and I are both in our 60s, and my son is a detective in New York City working with many COVID patients. And my daughter-in-law is a social worker on a COVID unit at Stony Brook, so she has high exposure. We watch our children every day from 8 hours to 10 hours a day. And I'm wondering if we're at risk, because they do go home to sleep and they come to us in the morning.
Well, that's a really good question. And first, thank your children for what they're doing as well through all of this. The challenge is that daycare for all of us with kids is very difficult, and we have to try and move on with life. So we know kids themselves are most commonly, if they are infected, they don't have any symptoms, or at the most, they're mild symptoms. And so we don't know if your grandkids are ever infected, and obviously they are at risk because your son and your family, the adults in the house, are exposed. And so I think what's really most important, particularly if you have to be the caregivers for the kids, is that the adults in the house really have a really significant decontamination process, which I'm sure they do when they get home, meaning they leave all their clothes outside or in a separate place, so you get a good cleaning of showers, et cetera. And I think most of us in the front line have been doing this before they ever see their kids. And of course, I would suggest personally that when you're with the kids, as best you can, one, hand hygiene is critical. Constantly, as best you can, keeping your hands clean. Keeping your distance from them, which is easily said, impossible to do. So it is a risk. I think it's a risk that I understand most of us have to kind of take. And so just keeping as good hygiene as possible is really going to be important.
Yeah, that's a tough situation.
It's really tough.
Yeah. How about Doug from Shelter Island? Doug, you there?
Yes, hello. Thank you for everything you do, Doc. My question is, when you're washing your hands, is it better to use hot water or cold water?
Good question. In general, it is recommended to use, I'll say, very warm water. Try not to use hot water that it's going to, you obviously don't want to scald yourself and burn yourself. I think most home water heaters should be set under 120 degrees Fahrenheit. So 100-degree water is considered, and it's recommended over our cold water. And what's more important, or at least as important, is the duration that you scrub your hands, because most of us, we put some soap on our hands, we rub quickly, 3 seconds later we're washing off the soap. That is basically a waste of our time and the soap that you bought. So scrubbing for minimum 15 to 20 seconds, which feels very long, but that's really what's necessary. So long scrub and warm water is ideal.
Yeah, I've learned to count to 20 seconds in my head.
It feels like 20 hours.
It does.
Yeah.
Diane from Westbury?
Yes, I had the coronavirus. Today is 42 days that I have no taste or smell at all. When will it come back, if ever? And is there anything I can do?
Well, I'm glad that you're feeling better other than the smell and taste, because obviously we know how sick people can get with coronavirus infection. My understanding of the, we call it anosmia, or the lack of smell, that goes along with this is that it is temporary. I've seen reports as it returning as quickly as 10 to 12 days. Because it's a newer infection in the population, we're learning a lot. So clearly it can last at least 42 days, but I'm hoping it doesn't last much longer for you. There's really nothing more to do or something specific you can do to help your taste or smell come back any sooner that I'm aware of. It's just time, unfortunately.
Yeah. Mike from Floral Park?
But I'm hoping it doesn't last much longer for you. There's really nothing more to
Mike,
do.
are you there?
Or something specific you can do to help your taste or
Mike,
smell come back any
is that you?
Yes, hello, doctor. How are you?
Good, thanks. How are you?
Hello? Yes, thank you for your service.
Thank you.
I was wondering what your thoughts were concerning a proactive regimen of taking, say, like 15,000 to 20,000 IU of D3 daily, and maybe like 50 milligrams of zinc daily to be proactive, as far as the coronavirus is concerned.
It's a great question. I think we're all trying to do things we can to try to be safe. I'm not aware of any data that supports or has shown that any of that is actually effective in preventing infection or at least minimizing the symptoms when you if you were to be infected. I think the most important thing, quite frankly, is trying to prevent contracting the infection altogether, which would go along with social distancing, hand hygiene, wearing a mask when you're in public, things like that. So I would be a little cautious taking extra medications that are not proven, just because there's nothing comes risk-free.
Yeah, and I guess vitamins in general just help your immune system boost it a little bit.
Yeah, they may, but but we've also seen toxicities of taking too many of these. So you have to be mindful. I would take the recommendation of your primary physician for that.
Okay. All right, we're going to take a real quick break, and when we come back, we're going to have much more expert advice on how to keep you and your family safe from the coronavirus. And remember, we do want to hear from you. This is a call-in show, so call in. The number is right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. James Schneider, the Chief of Pediatric Critical Care Medicine at Cohen Children's Medical Center. Doctor, before the break, we were talking about vitamin regimen. Mike had a question about that. Should people just ignore, because there are a lot of home remedies on the internet that people read, and who knows whether they work or not. Should people just ignore everything?
So I would never say ignore everything. I think people have their beliefs in certain things. I think when it comes to coronavirus specifically, it's still such a new infection for us, and I think we're learning a lot. I just always hesitate to recommend any kind of regimen that data hasn't borne out as being helpful, and I clearly also don't want anyone to hurt themselves by taking things that are maybe dangerous.
All right. Let's go back to the phone lines. Isabella from Smithtown, are you there?
Yes, this is Isabella. Thank you. Thank you for taking my call. My question is, if this hits people in the southern states like Florida, California, Texas, the warm states, and it seems to be just as bad for them as it is up here, do we really think that it's going to go away this summer?
Well, that's actually a really great question. It's a common thought that perhaps with the warmer temperatures that these viruses, which we often see more commonly in the winter, will just go away. And, we know from other common respiratory viruses, including other coronaviruses, that we do see them year-round. They tend to be more in certain times of the year. I think, knowing that this is fairly new and there's no real good immunity out there in society quite yet, because we haven't had the chance for that. I don't think any of us are really expecting for it to completely go away over the summer. It may go down a little bit, and we are all kind of expecting and preparing for a resurgence in the fall and winter. So this is I think we're all in for a long haul, and but again, as we get more and more data, it'll be easier to answer those questions.
All right. How about Karen from West Babylon? Karen?
Hello?
Yeah, is this Karen?
Yes, this is.
Oh, okay. What's your question tonight?
My question is, hi, Dr. Schneider. My question is, does the virus last on money? Because my aunts are elderly, and they don't believe in charge cards, so I'm having a tough time trying to keep them from using a lot of cash.
So there have been some studies looking at how long the virus can last on different surfaces. So money or paper, we do know that it can last for hours, maybe even longer. There's one study looked at on cardboard surfaces. I've seen it last for up to 24 hours. On stainless steel, maybe up to 3 days. So I would suggest continue to urge your family to either use plastic, or that's why actually a lot of restaurants now what we're doing is they're going to mobile payments. So there's just no exchange of any kind of currency.
Yeah, come on in with the plastic. It's fun. It's fun to use. All right.
That's my son says.
Yeah, sometimes too much fun. All right, let's go to Marilyn. Are you there?
Yes, I am.
What's your question tonight?
I know that everybody is working fast and furiously to develop a vaccine. Now, I know that a live vaccine is more effective than one that uses dead viruses. My question is, I know that there have been problems with shingle vaccines and reactions. Will this vaccine be a live or a dead vaccine? And if it is a live vaccine, will there in fact be problems with reactions?
Such an important question. I think right now vaccines are just right now in the development stage, and there are a couple of different groups looking at them both in the United States and worldwide. And so I think it's a little premature to be able to even answer that question, not knowing whether it would be a live or a dead virus vaccine. And also We're still learning, of course, how coronavirus itself affects the nervous system, which is really when you start to see resurgence of things like shingles and from the varicella infection. So it's a really important question. I'm sorry, I think it's just a little early to be able to be definitive about that, though.
Okay. Let's try to get Eli in. Are you there?
Yeah, I'm here. See Eli.
Well, what's your question tonight?
Okay, so I learned a long time ago that we can get vaccines from people that are already cured. So we have people that are already cured right now. My question is, why don't we have a vaccine already?
Well, what we're really doing right now, we're at the stages of looking at people who've had coronavirus infection and have been cured, and not necessarily creating a vaccine from them, but actually harvesting their antibodies. So we do, it's called a convalescent serum. We get their blood and we're able to remove some of the antibodies, which is what the body would create after a vaccine. And then we give those antibodies or that serum to patients with coronavirus, and it's been used in other infections as well. So right now we're at the beginning stages of starting to use that, because now we have patients who can provide the convalescent serum. However, it's still in a study phase, so we're not really sure yet how effective it will be. In our institution, we've done it a few times, and it's still very early. So it's a good thought. We're on it, and we'll be able to answer that question as time passes.
Do you think that this is going to be the new normal as far as wearing masks? It's like no shirt, no shoes, no service, no mask, no service?
Well, I let policymakers make those rules, but I think related to the risk of infection moving forward, I think because there's still a good percentage of the community that is not infected by this. We don't yet have a vaccine, and we won't in the foreseeable future. We're working on it, but it's really it's going to be a while where we'll be able to be out in public not wearing masks, I think, unfortunately.
Right. Yeah. It's probably the new normal. Thank you very much. That's all the time we have. Thank you, Dr. Schneider. Stay safe, stay healthy, and thank you for everything you do. And thank you. We'll see you after the weekend on Monday at 7 o'clock.